Each day, health departments in Minnesota and Wisconsin report new cases of COVID-19.
And each day we report those numbers, and so many of you have noticed the same thing we have been talking about in our newsroom, and that's the numbers on the Wisconsin side of the river are much larger than Minnesota's, double the number of infections. So we wondered why there was such a difference. Lots of options here, right? But these states are very similar, Heather.
They are. They're similar sized populations. Minnesota here, we have 5.6 million. Wisconsin has 5.8. Similar testing rates. We're testing right about the same amount of the population. So you can't really put it on there, but these rates have been, pretty consistent over the past couple of weeks.
All right, let's start with the first theory, and this was when I first started talking about it, people were like, well, Wisconsin had this earlier.
Right. So that is one of the theories. I ended up talking with somebody from the Madison, University of Wisconsin School of Medicine, and somebody here from the Minnesota Department of Health, because I wanted to get perspective from both sides. And the first thing both of them said was it really could be Wisconsin probably had COVID first. You look at their first case, it was on February 5th. Minnesota's first case was March 6th. Now, for a long time, it was just one case in Wisconsin. But as one of the experts told me, that one case, that was the one confirmed case, that was one case that we know of. That case is kind of the canary in the coal mine there.
I still don't see how that makes sense, though, because that one case, we've had similar testing, similar number of tests. So even if that one person were infecting other people along the line and we weren't getting those cases reported, what would that have to do with the numbers that are coming out now? 2 months later.
Right, because that person would have affected people much earlier, and then those people would have gone out to infect
So maybe, so
other
the sphere got bigger.
Right. Exactly.
Okay, possible.
Jason, the thing about this, and we have a couple theories we'll talk about today, but they don't really know.
Yeah.
Right? So.
Right. But that makes sense then. As the sphere gets bigger and bigger, then those cases get more severe.
Exactly.
All right. What about the Minnesota theory of exceptionalism, which is always our go-to?
You got it. We're
the
just
best.
so good
Nobody's
at social
as good as us.
distancing here. We're the best. We're better than everybody. A lot of people ask me this one. Well, didn't we close schools on a different days? No, we closed schools on the same day. Wisconsin stay-at-home order actually started 3 days before Minnesota's. I heard from both states there that they think they're both doing a pretty good job of social distancing. This one is hard to calculate, but Minnesota state officials here have consistently said they think we are doing an exceptional job at social distancing, and that is why our numbers are lower here.
Okay, certainly possible. I went to college in Milwaukee, lived in Milwaukee for a while. Milwaukee County is very different from Minneapolis and St. Paul.
Absolutely. And Milwaukee County has 50% of the COVID-19 cases in all of Wisconsin. Compare that to our largest county here, which is larger than Milwaukee County, Hennepin County, and they have 37% of the cases. So there could be something to do with the higher density, the higher rate of African Americans in that population. We know that historically that population has had disparity in the healthcare system, less access to care. So
might have more asthma, more some of the underlying conditions that some asked about Chicago.
They did, and I brought this one up.
That's a hot spot.
It is a hot spot, and so you thought, well, maybe it's people from Chicago, and I brought this up to the Wisconsin expert, and he said, no, he really didn't think Chicago was playing a big factor, because if you look at the density of southeastern Wisconsin on its own, it's already pretty dense there. So he didn't think much of it. But these are just some theories that folks are coming up with. But like with a lot we just said with COVID-19, there's a lot we don't know.
Right. Always. Yeah. Very interesting story, though. I appreciate all the insight you got there.